Hello, my name is Jason Daly. I'm here to discuss IV therapy in the pre-hospital EMS setting. I'll go ahead and start by saying that IV access is crucial in the management of medical emergencies and trauma patients in the pre-hospital setting, whether it's needed for a route for medication or large amounts of fluid in a trauma patient. Proper technique and sterile procedures are crucial in management of IV therapy. So, according to the article out of BMC Emergency Medicine, it states that although it is very rare occurrence, PVA's primary vascular access set by EMS were reported to be responsible for 28% of all cases of bacteremia caused by inserted catheters in the emergency department and ambulances. This study was done in a 5-year period. Therefore, it is of utmost importance to learn how to properly sterilize and site and use proper techniques. Little things in the field little mistakes can happen where the catheter gets dirty, or you don't sterilize with an alcohol prep. Lots of things can happen to where you have an unsterile setting. And I come from a background. I have been in the EMS field for 22 years. I'm a firefighter, paramedic. I started thousands of IVs. I'm not perfect, but I've learned to be consistent with being sterile and using proper IV access techniques. IV access is the preferred route for medication administration. Peripheral IV is preferred for drug and fluid administration unless a central line access is already available. A central line is something that is done by doctors. We don't mess with that in the field. It goes into your internal jugular or your clavicular line here, and it's more of a permanent thing for long hospital stays. We don't do that. We do peripheral IVs, which means your hand, your antecubital, which is in the crook of your elbow, external jugulars, even in the foot you can do. And here's a picture of an IV that was established that I'm going to go ahead and turn the camera around to. Where my cursor is, this is the tubing. This is a valve where you can administer medication right through there. You have an extension, which is this tubing here, that goes into your catheter. This is the piece that comes off the needle. This is a butterfly. You see these two? That's called a butterfly. It's a small needle for hand veins. And once you're in there, you tagoderm it down, which is like a sticky tape-like substance. This is taped. This is taped. And prior to doing that, you can use betadine or alcohol in concentric circles, sterilize your site before inserting the needle. And this is all important because there is no faster way to infuse fluid into a hypervolemic trauma patient. You guys know hypervolemia is low volume, low fluid, if you're bleeding, things like that. Pre-hospital intravenous fluid administration decreases mortality in trauma patients, especially in major injuries and rural settings when pre-hospital transport time is long. There's something in EMS and emergency medicine called the golden hour, from incident, from trauma to the body to the emergency room. You have about an hour, and giving someone fluid that is in a rural area that you're going to have a long transport time could be the difference in saving their life. Here are the two most important reasons for starting IV in a pre-hospital patient. Maintaining a sterile site and equipment when starting IV is crucial. And I have actually seen bad practice early on in my career when I was doing clinicals at a hospital. I won't say which one, but I was working with a nurse, and I seen that nurse drop the catheter, the needle and the catheter, onto the patient's bed, pick it up, and that should immediately went in the Sharps refuse. That should not have been used. It's already been contaminated to whatever was on that sheet or in the air. Being a student, thinking nothing of it, knowing that, hey, that was kind of unsterile to do that. Came back on my next clinical. A couple days later, the patient was still there. Had that IV removed, had a new one in place, and there was some redness in the arm, some spotting that suggested to me that maybe there was some kind of infection from the unsterile IV stick. So that's why you want to be very, very, very diligent in keeping the sterile site and keeping your needle and your equipment sterile, and your gloves. All your equipment needs to be sterile. It's not a problem if to throw it out and get a new one and start over. So that was my short, sweet speech. It was basically to inform you, getting into your pre-hospital EMS field, the importance of IV access in a pre-hospital setting. Whether you need life-saving cardiac medicines or you need a lot of fluid on board on a trauma patient that lost a lot of blood, it is crucial for the positive prognosis of the trauma patient. So you're paramedics, you're going to be paramedics. You got to use your skills. You can't just scoop them up and drive them to the hospital. There's things you can do in that ambulance that can save lives. Thank you.